We have the sagittal suture that just runs right down the middle of the two parietal bones. And the parietal bones, you'll notice some of these little, basically foramen. They're just kind of tiny little things, but they're just referred to as the parietal foramen. You also have the lambdoid suture, or lamboidal suture, that separates the parietal bones from the occipital bone. And then the area where these sutures meet is called the lambda. You see three nuchal lines. You have one that's considered the superior nuchal line, which basically runs right even with the external occipital protuberance. So that's referred to as the superior nuchal line. The highest nuchal line is above that, basically just runs higher than that, and then the inferior nuchal line runs below it. You can't really see it too well from here, but yeah, it's basically just below. From the top of the skull, we have two basically bumps around both sides here that are referred to as the parietal eminence. It's the place on the parietal bones where it sticks out the most. Then you have your coronal suture on the front. Once again, your sagittal suture here, and the area where those meet is called the bregma. It's just this area where those three sutures meet. You have the frontal crest that basically just is this little, it's a crest that runs just right down the center line of the frontal bone. And then the grooves for the medial meningeal vessels are basically any of these little grooves that would basically make a spot for the vessels to be. We start off up front here, where we have the incisive foramen just in front of the incisors, and then just behind that we have the palatine process of the maxilla, which makes up this area. I'll move this out of the way. Behind that we have the horizontal plate of the palatine, which is just this area right here, and that makes up your soft palate. So that's your hard palate, and then your soft palate. Then you have your greater palatine foramen, which are right here. Your lesser palatine foramen, this is also greater palatine foramen. Your lesser palatine foramen are just behind those. Usually you have two. That's when this model just shows just having one. Then you have your pterygoid hamulus, which just come off of your medial pterygoids, just right here. And these don't have protruding pterygoid hamuluses like other ones, so usually it comes up a little bit higher just off of here. Pterygoid hamulus. And you have your medial pterygoid plate, which is right here. Your lateral pterygoid plate, which is right here. Your inferior orbital fissure, something you can see from here. Right here is your inferior orbital fissure. Then we have our zygomatic arch, which is just, as we know, just on the outside here. Have the mandibular fossa, which is basically just the place where the mandible is going to articulate, so it's just right in this area here. The external acoustic meatus is just where the ear hole is, so just right there, external acoustic meatus. Then we have the styloid process, which is just this little process that sticks up here, and then just behind that we have the stylomastoid foramen, and this is the mastoid process. Okay, then we have the occipital groove that just runs right here, right next to the mastoid process. Then you have the mastoid foramen, which is just down here, basically behind the mastoid process. Then you have the superior nuchal line, which we've covered before, which goes right along with the external occipital protuberance. You have the inferior nuchal line there. You have the foramen magnum, which is our big gigantic foramen there. Then next we have the occipital condyles, which are on just both sides of the foramen magnum. It's a place where it articulates with the spine, or actually hypoglossal canal, that just runs right here. And then right next to the hypoglossal canal we have the jugular foramen that just goes right here. And then next after that we have the carotid canal, which would just be this area here. Then we have the foramen spinosum, which is kind of a smaller one, but we'll find it right here. Foramen spinosum, which is right next to the foramen ovale. And then right over here next is the foramen lacerum. And then the last thing that we have on this view is just the posterior nasal spine, which is basically the tip of this area right here. To start off, we have the diploe, which is just basically this area that's just in the front here. Spongy, porous, bony tissue between the hard outer and inner bony layers of the cranium. Which within that you'd have the frontal sinus that you can't see at all in this one. Then that leads down to the frontal crest, which is just down in this area, which goes directly into the foramen cecum. It's just a little foramen that's right at the top of the crista galli, which is in that area. So we have foramen cecum here, crista galli, which is in the middle of the cribriform plate of the ethmoid bone. Then you have the groove for the anterior ethmoidal nerve and vessels, which are just kind of marked up by some of these red grooves. Then you have the lesser wing of the sphenoid, which is just basically this area here. And in the middle of the lesser wing, you have the jugum of the sphenoid. It's this little crest that's just in the middle of it. And then below that, you have the prechiasmatic groove, which just basically is the groove that runs right in between both of the optic canals. So this makes up our prechiasmatic groove. Then you have the trabeculum sellae, which is basically just this ridge right here just before you go down into the sella turcica, or what people call the pituitary fossa as well. So this makes up your pituitary fossa. It's where your pituitary gland sits. And on the back side of that, you have the dorsum sellae, which is just this right here. Then we've already talked about the optic canals that run through here. Then you have the anterior clinoid processes that stick out on both sides of the lesser wing of the sphenoid. They're just basically these two little spots. Then you go down a little bit further and we can start getting into some of the foramen that are down here. First off, you have the foramen rotundum that is down in this area. Then as you come back again, you have the foramen ovale and the foramen spinosum just behind that. And then you have the foramen lacerum that's on the other side of the cell, or on both sides of the sella turcica. This down here is considered the greater wing of the sphenoid on both sides. And you have grooves for the middle meningeal vessels that are just kind of marked over here as well. And you'll see the grooves inside of the skull. The squamous part of the temporal bone is just roughly this area. And then you have the petrous portion, which is just basically this big ridge in this area. Petrous part of the temporal bone. Then you have the internal occipital protuberance, which is towards the back here. It's just basically this part that protrudes out the most. And right before the foramen magnum, that big area. Then you have the hypoglossal canals, which just run here on both sides. And then you have your jugular foramen just above those, or just next to those. And then you have your internal acoustic meatus, which is basically where you can hear from, just right next to the jugular foramen as well. And then you have the clivus, which is basically just this slide that takes you down from the dorsum sellae down into the foramen magnum. It's called the clivus. And you have the posterior clinoid processes. They're on both sides of that as well. They're basically just the peaks here of the dorsum sellae. Carotid groove is kind of hard to see. It's something you'll probably need to look up in the book or in your book. And then you have the trigeminal impressions, which are basically right next to the foramen lacerums. There's these little impressions right here. You have the foramen lacerum right there. And then lastly, you just have the superior orbital fissures that you can see whenever you lift up. And you got both of those that kind of look like cat eyes. I went down to the Apple store and guess what I bought? What? An eye patch. Arrgh.